morphology. So in the morphology of Neisseria coli, so it is gram negative bacilli. It is gram negative bacilli, and it is motile. When we look in the microscope, it is motile. So regarding virulence factor of E. coli, virulence factor. When you look at virulence factor, there is a Q1 capsule, and it is resist phagocytosis. And moving on to transmission, how it's transmitted. So it's transmission from the maternal mother to the child, by at the maternal birth canal, and it is common seen in the neonates, commonly seen in neonates. Moving on the culture. So culture for this organism E. coli, we can use McConkey, and we can also use EMBR. Moving on, it's when check there it is a lactose fermenter organism. Fermenter. It's lactose fermenter. So now we are moving on to another organism. That organism is Listeria monocytogenes. For this organism, morphology, this organism is gram positive and bacilli, gram positive bacilli. It's motile, and it's when we look at the motility, that motility is the like tumbling mortality. So mortality, and it is the facultative intracellular organism. Facultative intracellular organism. When we look at the transmission of this organism, this organism through the transplacental, like it placental, and or through it is contaminated through the food or milk or cheeses. Contaminated food, milk, cheese, and regarding virulence factor, it has a type of lysine, like known as listerio-lysine O, and it's help to the like escape from the phagogens, escape from Lysosome, phagocytes, sorry, escape from phagocytes, and moving on, like it's common in the neonates and elderly with immunocompromised patient. And for the culture, it's grow at the 4 degree of temperature, grow 4 degree of temperature. So we need to cold enrichment medium. These are the regarding the microorganisms, which organism causing. So this is acute or pathogenic. So we have already discussed regarding the staining and the culture media and everything. So I am moving on the like chronic type of the organism or chronic bacterial meningitis. So moving on the chronic bacterial meningitis. So in the chronic bacterial meningitis is defined as like inflammation more than 4 weeks, or meningeal inflammation occurred more than 4 weeks, and clinical symptoms or abnormal CSF finding persist for more than 4 weeks. Clinical symptoms with and or like there is abnormal CSF finding like persist more than 4 weeks finding. So unlike there is acute pathogenic meningitis, it has like slow insidious, like slow onset, and like it commonly caused by the mycobacterium, commonly caused by mycobacterium tuberculosis, and there is a spirochetes, and then fungi. So moving on the specific organism. So before going to like there is a common pathogen, so I am going to classify the pathogens for the there is a mycobacterium tuberculosis, mycobacterium tuberculosis. Like when we look at its type, type is acid fast bacillus, and like when the look for the source, so it is hematogenous spread or from the pulmonary focus. So there is a hematogenous spread from, we can also like mention from pulmonary focus. There is already infection of the microbiome in the pulmonary, and then leads to the otherwise treponema, pallidum. Like it is a type of spirochete, and it is like a later stage of neurosyphilis. It leads to the neurosyphilis. Then there is another Borrelia Burgdorferi, and it is also a spirochete. Then is a Leptospira, Aspira interrogans, which also a asparagid. Then there is a like gram-negative Coccobacillus is Brucella species, Brucella species, and this is the gram-negative Coccobacillus, Bacilli. Then there is actinomyces and Nocardia species. This is a gram-positive bacilli. Okay. Now we can move on the like specific organism. So first I am going to describe the Mycobacterium tuberculosis, and then we can discuss chronic tuberculosis disease, what are the findings, and then we discuss other organism briefly. So we are going to focus on the tuberculosis. So Mycobacterium tuberculosis. So it is like when we look at the pathogenesis, so tuberculosis or tuberculosis bacillus, Mycobacterium tuberculosis bacilli reaches to the CNS by the hematogenous route, and then disseminated in the primary. It is from the primary pulmonary focus, and then it reaches the like brain parenchyma, rupture the subarachnoid into the subarachnoid space, and cause the basal meningitis, and leading to the fibrosis, hydrocephalus, and cranial pulses. So there is like that pathogenesis is not much needed. So that is mainly understanding like there is a like hematogenous spirit, genus spirit, a forum, primary pulmonary focus, and then this disease occur and go in the cerebrum, in the cranium, and that leads to meningitis inflammation. So in the like when we already discussed like in the bacterial there is like how there is the some factors change. So I am going to briefly explain regarding the CSF finding. So here there is a clot, there is like there is appearance like there is the some cobweb appearance, or the slightly opalescent appearance, and there is a lymphocytic pleocytosis occur, and there is more lymphocyte in the CSF, and there is a less glucose, and also protein is more higher in number, and we can culture in the like Lowenstein Johnson media, and like there is like AFB stain also done for but there is a less sensitive for the CSF. I think I have explained in the first video. So this, and there is like rapid test in this rapid test. For the rapid test we can use like CBNet, and it is a gene expert, and there is also we can use PCR for the detection, and these are the things which understand in the Mycobacterium tuberculosis. So moving on to other kinds like Treponema palladium, and that is like it is a complication of syphilis, and there is like CSF lymphocyte and pleocytosis occur, and there is a rise protein. And when we discuss regarding this Borrelia burgdorferi, it is like also Borrelia burgdorferi is like other name is like known as like Lyme neuroborreliosis, neuroborreliosis, and it is like there is a vector of the like a tick vector, and regarding in this there is a CNS sign like facial palsy, meningitis, and radiculitis are also seen, and for diagnosis we can use ELISA and Western blot for the antibiotics. And there is in the regarding the leptospira intrigons Leptospira intrigans. It is like biphasic illness. Like initially it is septicemia phase and followed by the meningitic phase. First initially there is a septicemia, then after the meningitis occur. So when we look at the diagnosis for this, there is like microscopic augmentation test is done, MAC, and MAT is done, microscopic augmentation test, and also there is the PCR. We can use PCR. And regarding, there is a similar to the viral meningitis, but the culture of the culture and PCR confirm for leptospira. And then regarding the Brucella species, like it's zoonotics and transmission through the unpasteurized milk, pasteurized milk. And regarding this is the meningoencephalitis, and this is also little meningoencephalitis. Diagnosis for that we can use blood and CSF culture and Brucella agglutination test also done. Regarding the Nocardia species, so regarding Nocardia, this is like opportunity if the immunocompetent patient is seen and there is like brain abscesses. It is from the brain abscesses. Chronic, it is a chronic and weekly acid fast. So the branching filament seen weekly acid fast, and there is like branching filaments, and when we look at the like the chronic feature of the chronic meningitis clinical feature. So in this, like there is a persistent headache, low-grade fever, vomiting, cranial nerve palsy, and behavioral change. Neck stiffness may be subtle or absent. There is, and these things are in the chronic bacterial meningitis. So we have already discussed regarding the acute and chronic. So when we look at the difference, there is not much difference, but in acute or there is like pyogenic meningitis, so there is the neutrophil is more prominent, but in the chronic there is a lymphocyte is more prominent and more when we look at the glucose level. In the acute pyogenic there is a less amount of the glucose in the CSF, but in the chronic bacterial meningitis there is slightly decrease of the glucose level in the like this, and there is a 1 week duration, less than a week or less than 1 week in the acute, or the certain 1 to 2 days, 3 days in the we can see in the acute meningitis, but in the chronic more than 4 weeks. We'll already discuss there is a lot of organisms. So I am ending the video. Thank you.